Ai, se tu soubesses como eu sou tão carinhoso e muito, muito quem te quero.
Samia Pani was born in Bangladesh and raised in the Philippines, Indonesia, Argentina, Canada, and North Carolina. For 32 years, Samia has called the Pacific Northwest home. Her home for health care is HealthPoint in Kent, where she enjoys the benefits of coordinated care that includes both Western and naturopathic medicine.
I feel very strongly about the fact that we have a right to choose how we're cared for. Who's going to be our doctor? It's our body, after all.
Luis Garcia is a patient at HealthPoint in Renton. He also is a member of the HealthPoint Board of Directors.
If anyone just can make a little positive thing in our community, I think that this community will be a much, much better place.
Samia and Luis don't know each other, but they know HealthPoint, and they're just two of the 50,000 people in King County who receive care at one of HealthPoint's 12 locations. Our patients know the value of accessible care, and for them, health care is more than a doctor's visit.
I'm able to communicate very comfortably with my healthcare provider at HealthPoint.
In a multi-pronged approach, HealthPoint extends its reach to the community by offering primary medical and dental care, behavioral health care, pharmacy services, health education, naturopathic medicine, acupuncture, nutrition counseling, and a variety of other services that people want and need, with special attention to the underserved. HealthPoint is deeply integrated with the social services infrastructure of King County. Ruth Michaelis is a family physician. She's been seeing patients and delivering babies here for 6 years. She also is an instructor to the students who study medicine here.
When I thought about going to medical school, it was always to have a career working in an underserved community. I felt like by going to medical school, I could help to solve some of those problems of access.
Vilmari Mendieta is a front desk coordinator who understands the value of what HealthPoint provides.
The reward of working here is the fact that we are able to make a difference in someone's life. And for me, that is the biggest satisfaction.
HealthPoint is a local response to a national need for accessible health care. Many of our patients are best served in a language other than English, and HealthPoint is ready with on-site interpreters and translation services. With our rich history of delivering health care and our responsiveness to a diverse patient population, HealthPoint provides care that is culturally competent and comprehensive.
I think being very intimate with patients in their lives is incredibly meaningful.
Without HealthPoint, many of our patients would not receive health care. We've set our sights on removing the barriers to good health, and our patients know they have a voice. In fact, over half of our volunteer board of directors are HealthPoint patients.
I think being a volunteer at HealthPoint is a blessing for me. It gives me the opportunity to feel me that I am useful. That's why I volunteer.
And to make sure there are plenty of providers who are committed to community-based health care, we have a partnership with A.T. Still University to provide clinical training for students of osteopathic medicine.
You get to know your patients over the course of several years in a way that I could never have imagined. You really become close and want to hear their news and their stories, and it makes taking care of them really a pleasure and a privilege.
It was my first experience here in this country for medical. The people was warm. They treat you with respect.
Working within and beyond the walls of our clinics, we offer services whose effects radiate in all directions. When you join forces with HealthPoint, and we hope you do, you're joining a longtime leader and innovator in community healthcare. Our record of compassionate, high-quality care is strong. Our vision is broad, and we're growing. By removing barriers between people and good health, we're improving the quality of life in our communities.
If you don't have a good health, you're not going to enjoy life.
That's the first step towards decent quality of life, is being healthy, physically, emotionally healthy. It's paramount to living a successful and happy life.